Chemicals or drugs that activate receptors and produce a response are called agonists. Well, imagine them as a hero of a movie, ready to save the day. And like most heroes, some drugs also have a villain who are ready to spoil their plans. They are called antagonists. Well, they combine with the receptors but do not activate them. And they reduce the probability of the agonist to combine with the receptor, and so they reduce or block its action, which is why they're also called blockers. So there are two main types of pharmacological antagonists: competitive antagonists and non-competitive antagonists. Well, we must not forget a few other types too, which are functional antagonists, physical antagonists, and chemical antagonists. Well, starting off with competitive antagonists. Well, as the name implies, the antagonist and the agonist are competing for the same site on the receptor. Now, if the antagonist wins, it prevents the agonist from binding to its receptor, maintaining the receptor in its inactive state. So there's a possibility that one may win in this contest, which is why increasing the concentration of one substance can overcome the other. For an example, the antihypertensive drug trazodone competes with the norepinephrine at alpha-1 adrenoceptors, thus decreasing the vascular smooth muscle tone and reducing blood pressure. Now coming to non-competitive antagonists. These are a type of antagonists that may act in one of two ways. They can either bind irreversibly to the same binding domain of the agonist, or it binds to another domain on the receptor known as the allosteric site. Now, in contrast to the competitive antagonists, the effect of a non-competitive antagonist cannot be overcome by adding more agonist. If you look at the irreversible antagonists, they bind permanently to the active site of the receptor via a covalent bond, or they bind so tightly that the rate of dissociation is somehow close to zero, thereby reducing the number of receptors available to the agonist. Now, irreversible enzyme inhibitors that act similarly are clinically used and include drugs as aspirin, omeprazole, and monoamine oxidase inhibitors. Now, allosteric antagonists bind to a site other than the agonist binding site. Now, this other site is known as the allosteric site or the non-agonist site. Now, this binding usually changes the receptor in a way that it prevents the agonist from binding to the receptor. Now, an example of an allosteric antagonist is picrotoxin, which blocks the GABA-controlled chloride channel. When picrotoxin is bound inside this channel, no chloride can pass through the channel, even when the receptor is fully activated by GABA. Now, the other types of antagonists are less common, but we should not ignore these anti-heroes too. Talking about functional antagonists. Well, you might get a better idea about what they are if I tell you that they're also called physiological antagonists. Now, these antagonists may act at a separate receptor, but they initiate effects that are functionally opposite to those of the agonist. Well, a classical example of functional antagonists are insulin and glucagon. They act at different receptors, but they have opposite effects on the blood glucose levels. Now, we also discussed physiological antagonists in our hemostasis lecture. Prostacyclin keeps the blood vessels in a dilated state, whereas thromboxane A2 is a vasoconstrictor and it constricts the blood vessels. Now, physical antagonists can bind to the agonist and prevent its action. For example, when charcoal is used in the case of poison ingestion, it has the ability to absorb the poison, and in this way, it prevents the poison from entering the bloodstream, thus countering it. Now, chemical antagonists prevent the action of agonist by modifying or sequestering the agonist via certain chemical changes. and thus agonist cannot bind and activate its receptor, and so makes it ineffective. For example, protamine sulfate is a positively charged drug. When it is administered, it binds to heparin, which is a negatively charged drug, forming an inactive complex. And as a result, what is happening? The protamine abolishes the anticoagulant effect of heparin. Now, this was a short video telling you about the different types of drug antagonists. For more detailed videos, stay tuned on sqadia.com.